every 40 seconds. For every person who commits a suicide, 20 or more may attempt to end their lives. So, suicide is a major preventable cause. Today, Dr. Ruhi Satija, a well-known psychiatrist and psychologist, on behalf of Rotaract College, I heartily welcome you, ma'am. It's really great to have you today here. And I welcome all the audience who are present here. It's really great to have you all here. There will be a question and answer session towards the end of the session. So if any of you have any doubts, please do type it in the chat box. And the people who are streaming live on YouTube, please type questions in the comment section. We will be acknowledging all the questions. Once again, you all. Thank you.
Hi, shall I start?
Yes, ma'am, please.
All right. Good afternoon, everyone. Am I audible clearly? Because I'm having some sort of disturbance from my side. Is this clear?
Yes, ma'am, you are clear.
All right, all right. Okay. Good afternoon, everyone. Again, I'm Dr. Ruhi Satija. Thank you for the opportunity, and I'm really glad that this is being discussed today, especially in the youth. And I congratulate you all for taking this initiative because, as very well mentioned in the introduction as well, that this is one of the most preventable cause of death. Especially in the youth, earlier it used to be road accidents and various illnesses that were major causes of death. Right now, the patterns that we are seeing is that in the youth, suicide is one of the most common cause of death. So it's important that we learn about it. It's important that we know that this is preventable. And when it is preventable, the best thing to know in that is what you can do personally in that, right? The number of psychiatrists in the country, we hardly have 8,000. We have a 100 crore population. So it's not possible that a mental health professional can be everywhere. And the initial steps that are required to prevent this often can be done by the family members, and the friends. So if I really, I'm happy when I see the youth getting involved in, and they are enthusiastic to know, and the kind of awareness that is being created about mental health really gives me the pleasure, because I know that if we have more people like you in the society, we are definitely going to reach our goal, which is creating a society healthy for everyone and inclusive and understanding as well. Talking about suicide, rightly mentioned, 1 in 40 seconds commits suicide. The rates that we see worldwide is almost 1 million people die or suicide every year. The attempt rate, that is how many people attempt, is 18 to 20 million. So that essentially means that if 20 have attempted, one has died out of it. But the impact of suicide is much more than that. How? Because it is not just the person who dies is affected by it. It is also the family members and the friends and the people who are in close collaboration with that person get affected by that. A very common example that we are seeing is the recent suicide case or the murder case, whatever happened, it was seen as suicide, and the rise in the number of suicides after that and anxiety and depression in society has increased many folds. The number of calls that all the psychiatrists were getting in the next 2 to 3 weeks was substantial. Okay, so not just a person who is getting affected, it is all of the family and society in and around that get hit by it. Okay. Now, coming why this happens, why somebody commits suicide. The common reasons, we all know that there are family issues related, which is the most common cause. And we have chronic illnesses, somebody who has cancer, somebody who has Alzheimer's disease, chronic pains where, we do not have treatment. Often people do not, because they are hopeless and they don't find a way of coping up, they feel that dying is a better way to cope up with that because they don't see a value in their life. I will talk about what they go through in detail in a short while. Next thing, common thing that we see is drug abuse and addictions, especially alcohol addiction is one of the common causes of a person committing suicide. I'll talk about mental health disorders specifically because that is the most important thing that we can talk about when preventing suicide, because many family issues, many relationship issues, etc., are very, very personal and individual. So we can't have a generalized notion about that. But when we are talking about mental health disorders, depression and anxiety, which are normally called the mood disorders, are the most common cause of death. Almost 35% of the people who die due to a mental health disorder have an underlying depression or anxiety. After that, the second disease that causes people to have this tendency is addictions. Alcohol being the common one, but of course, any addiction can lead the person to have a mood disorder, as well as seeing that once they are not able to recover and once they start seeing that they are being a burden on the family, they decide to go this way. Then we have schizophrenia, which is a psychotic illness. You all must have heard of a name. I'll just briefly explain what that is. People have psychotic symptoms, which essentially means they might have some delusions, which are strong beliefs that somebody is harming them, somebody is following them, somebody is trying to do something wrong to them. In lower social economic status, the common version see it, they feel that they are being possessed or somebody is doing black magic on them. They start seeing things which are not there. They start believing things which are not there. They start hearing things which are not there. These are all psychotic symptoms. Of course, schizophrenia being one disease which can present symptoms, there are many, many more. Apart from that, one thing that you all need to know is personality disorders. Now, it's a very complex topic. You might not be able to understand, but we all have encountered people who are a little difficult to deal with in our life, who are, different, who behave in some ways which might hurt other people, or, they might be hurting themselves as well. These come under personality disorders. They have certain characteristics which are very distressing for themselves as well as it becomes distressing for the people around them. So these are personality disorders, which is the fourth number of the cause of suicide when it comes to mental health disorder. Coming to the statistics, when we talk about our country, the common states which have a higher tendency of suicides is the highest being Andaman and Nicobar Islands. Then we have Sikkim, Kerala, Karnataka, Maharashtra, Haryana, and Delhi. These are the states where the rates of suicide are much more. There are various reasons for that. There is various, social factors, economic factors, stress factors, which are there in these places. But of course, we can generalize, but one can also see that the patterns are there because once we know that somebody has done it, it certainly, shows us another way as well. And especially the way social media portrays it as if, in movies, we see that if you have a failed relationship, the best thing to do is that you die. There is nothing left in life after that. Students commit suicide if they fail in some exam because they don't have coping mechanisms to face the failure. The family pressures are such, and life is huge, right? I will talk about that in detail. It's a very emotional aspect of it, that it is sad that if we have one relationship or one failed exam, we feel that our worth lies in that. We see ourselves as a failure if we fail in one aspect of it, and the best thing that we see as a solution of it is dying. So that is the saddest thing that anybody can push through. And of course, it is not always the person who is responsible. There are many, many people and many, many factors involved in them reaching that age. Okay? The common myths that we have about this, about suicide, I'm really sure, you must have heard that he keeps on threatening, he doesn't want to die. The one who speaks a lot is actually paying attention and, they're never going to do it. This is one of the commonest myths that they have. But the rates that we have, the research rates that we have says that 80% of people who attempt suicide actually talk about it before dying. they do inform somebody in some or the other way that they are planning on do it or they are leading towards it. It's just that people don't take them seriously, or sometimes the warning signs is that they won't verbally come and tell you, but they definitely have these tendencies and change in behavior, which later on, if we read about it, we know that all right, he was doing it or she was doing it before that, but we didn't realize that this meant that. Okay, we are going to talk about those warning signs as well. The second myth is that somebody who actually wants to do it will just do it slowly and quietly. Again, put to it that no, they are verbal. They want to do it. They give the cues. Some people are just expressive. They don't want to come out and talk about it, but they give the cues here and there, and they are hoping that somebody will intervene and stop them. But what happens is when people don't, their idea that they are not being cared about, they are alone, gets reinforced. That all right, see, anybody doesn't care. I even told them that I am planning on doing it and still nobody cares, so it's better that I die. The third myth that we have to do is that the person who is attempting suicide is doing it because they want to die. The current understanding of suicide that we have tells us very clearly that the intention is not to die. The intention is to escape the reality. The life that they are in, they feel that they are stuck and there is no way they can get out of it. The only solution that they see to the end of suffering is death. So it is not that they want to die, but it is that they don't want to live the reality that they are in. Another thing that commonly we believe is that if somebody has attempted once, they are at constant risk of doing that again. Definitely, there are chances, but the highest risk that is there if they have attempted once is for the next 3 to 6 months. If the people are given the necessary treatment and necessary therapy, which I will explain how it's done, if they are going through that, the chances of again attempting suicide reduces a lot. Okay. The next thing that we see is that it happens in very, very poor population, or it is the very rich who are doing it. But the research very clearly shows that it is prevalent in all socioeconomic stratas. There is no distinction like that, that only the rich are going to do it or the very poor are going to do it. Another myth that they have is all the people who commit suicide are crazy. They have a mental health issue. That is also not necessary to you. Although there is a basic mental illness in most cases, but that does not mean that everybody who is attempting suicide has an underlying psychotic disorder going on. As I even in the beginning have mentioned, that it is the mood disorders like depression and anxiety, which is not psychosis. They are the reasons of the maximum number of suicide attempts or suicidality when it comes to mental health disorder. So essentially what we have understood about suicide till now is that we think that they are trying to kill themselves, but it is not the killing. They are just trying to end their pain. The another thing that they are trying to manipulate, which I have explained you, that it is not like that. They are not trying to manipulate the other person to do what they want. Some fraction of people who have personality disorders do self-harm to seek attention. But then again, you have to have that type of a sympathy in you to see that if somebody has to go to these extremes, these measures, to feel safe or to get the attention that they want, imagine what they are personally going through. Maybe they actually don't have anyone who is understanding what they need, so that they have to reach this level of self-harm so that somebody can. Any attempt of self-harm or suicide is a cry of help. It is not attention seeking. Okay, so if somebody is doing it, sometimes it's very difficult for ourselves as well, because we don't know what to do in that situation. Mostly what people do is they just try to cut them off. That is the worst thing that we can do. Okay. The next thing that we have to understand is, earlier it was thought that it is just a psychological issue. Now we know there are many physiological and neurological processes involved in this. Okay, it is not just that a person will one day think that all right, today I'm going to attempt suicide, tomorrow they'll do. It doesn't work that way. It is a chronic debilitation process. Chronically, they have been feeling hopeless, they have been feeling worthless, they have been feeling that there's no escape. That is when they do anything of these sorts. Okay, so it is not a one-day phenomena. In fact, the impulsive suicides that we see, that somebody lost somebody near and dear one, and after a few days they attempt suicide, that is a very, very less ratio of people who do it. That is a fraction of the total suicide. Most of it have it as a process. Most of them have a long-term thing going on in their life, long-term process going on, which is making them feel worthless and making them helpless in chronic ways. That means in long-term ways. That is when they try to do something. Okay. So this is, with this understanding, knowing that this is not something they are just doing it for attention, and knowing that this is preventable, now we are going to come to the process of ABCD of suicide prevention. That essentially means what you can do if you see somebody, or if you hear somebody, or if somebody expresses to you that they are planning on attempting suicide or they are planning to commit suicide. Okay. Now, A being assessing. How do you assess the patient? Now, there are two categories of people. One is who will verbal you that they are planning suicide or give you some direct signs. And then there are people who do not give direct signs, in which we have to find out the warning signs. First, we are going to talk about the people, which is that they have already confessed to you or already shared it with you that they are planning to commit suicide. What would you do in that case? Now, if some of your friend, even if you feel that he was not serious, he was just casual about it, there are a few questions you can ask them to see whether they are actually planning on doing it, how much risk is there. Okay. The first question that you can ask is, do you have a plan, or do you have any thinking about the method by which you are going to do? Okay. Now there will be two answers. One is they'll already tell you a plan that, see, I plan on doing it via this method. Then that means that the person is at a very high risk of attempting suicide, because he has already found the ways. But if somebody says they don't know, but they do plan on doing it, then it is a moderate risk. It doesn't mean they have to be ignored. It just means that it is not a crisis right now. Okay. The next question that you have to ask them is, when are they planning to do it? Many times what happens, it has been seen is that these things are called anniversary deaths. For example, if you have lost somebody, close one, what people tend to do is that on their deaths or on their birthdays, next year, they plan on dying, because their belief is that if they'll do it then, they will, maybe meet them in the other. That is a common belief. So if they are specific about it, that when they are planning to do it, if you have a specific answer to this question, it is a really high risk situation. The next question that you have to ask is, where are they planning to do it? So first was, any plan is there or not? When are they planning to do it? Where are they planning to do it? They have decided any place. Many people choose the same spot where they lost the last person, or where they had that failed relationship, Otherwise, there are, for example, you must have heard that this is a suicide point, right? So these are the places where there is some sort of an isolation. The people are, people can do it because there is nobody to look around or nobody to stop them. It's a bit safer for them to do any of these measures. So these are the places that they will choose. Then what you ask is, if they have ever tried before. If there is a suicide, even if they say that, yes, I have tried to hurt myself, then you have to be alarmed. If somebody has tried before, that means because they have failed once, this time they'll be even more prepared. So the chances of doing it again and getting success at it, that means actually dying by it, increases. Okay. Next question you ask them is, why? So as I mentioned, for most of them, it is not death that they are seeking. It is a solution that they are seeking. If they will tell you that, it is because I know I'm a burden to the family, it would be better that I die, it would be better if I'm not there, the other people will be well off without me. It's a very high risk situation. You need to take it very seriously, because now they see the world better without themselves. So it is a very strong motivation to attempt suicide. Whereas if they say that I want to do it, but it is going to hurt my family, that means that maybe you have few days or few hours that you can do something in that period and get them some help that is required. If what to do in the high risk situation as well, I'll tell you. Okay. Another question that you can ask them is whether they have talked about this to somebody else, whether their family members or their other friends, whether more people know about it. Because again, like I mentioned, they tell somebody and then the person doesn't do anything to help them. That reinforces the idea that nobody cares. Okay. And also one specific question that you have to ask is whether they have taken professional help. Professional actually means it has to be a mental health professional, a psychiatrist, a psychotherapist, a counselor, a social worker, mental health social worker, they are called MSW. Anybody who knows about mental health, because suicidality is an emergency. It is a medical emergency. Even if the doctor will see the patient, they will not just write the prescription and send them home. There are many interventions that the doctor or the psychiatrist or the psychologist are going to do to make sure that the person is okay. All right. Now, the next question that you have to ask is, how will attempting suicide help them? What is the motive behind it? Okay. So if it is just that they want to escape reality, we have to work on how to make it better for them. Sometimes there are many other reasons. Sometimes, if there is a failed relationship, the belief is that I'm never going to meet anybody new. There's never going to be anybody who can compensate for the current partner. If they have failed in exam, they see themselves as a failure. They see it as if their future has ended, that they are not good enough for anything else. If they don't get this, that means that is an end of life. And we all that this is not true. Everybody has multiple talents. Everybody can do so many things. It is never that, definitely we all have that one dream that we want to achieve, but that is not the end of life. And sure enough, that is not a definition of who you are. Any successful person, if you will pick up and see their biography, you will see that they have a series of multiple failures in life. Nobody succeeds without first failing failure. There is nobody in this world who becomes anything without failing first. You have to keep that in mind. So, whenever these feelings come, especially before the exams, or especially if you have some relative or family issue going on, you have to know that even if everything fails, the fact that you are alive is enough for you to get out of that situation. There is always something that you do. There's always something that can be done in that situation for you to solve it in one way or the other. If it is an abusive relationship, if you can't escape the person, you can always take help of authorities for you to get out of it. You can always get into a better relationship, or even if you don't get anyone, just be alone. That is better than being in an abusive relationship and ruining your life. Okay? This was the A of it, testing. When somebody has expressed the emotion of attempting suicide, what do you do? These are the questions that you ask. When do you plan on doing it? How do you plan on doing it? Where do you plan on doing it? Why do you want to do it? How will it help? And whom have you talked to? Okay, this is the A part of ABCD. Now, B part is being there. This is the most essential step. Even if you are not that close, if you feel he has his family who can take care of him or take care of her, there are closer friends, and I am just by chance in this situation, make sure that for some time, first thing is that you leave the person alone. Okay. Second thing is that you need to do is that you distract them by one way or the other. Ask them all these questions. Then what you have to do is try to change the topic. Right? Don't talk about life. Don't talk about how they have been through this or that. Just go for a walk, watch some TV, something to distract him or distract her, so that you can buy some time to do rest stuff. Okay. Another thing that you can do is, first of all, check whether they are under influence of alcohol or any drugs in that moment. Because what happens is, when you are under influence of any of these drugs or substances, it reduces your cognition. What that essentially means is the thinking power, the prefrontal cortex that we have in our brain, which makes the decisions, which makes us think rationally. it is suppressed, especially with alcohol. Okay, you can't think rightly, you go on your impulses more. You must have seen people who are drunk acting in very, very weird ways, which normally they'll never think of doing, right? That is because their inhibitions and their radical thinking capacity is reduced. So what they succumb to is that, whatever their impulses are, and now if the impulse came that I should do it under the influence of alcohol, it is easier to do. It is definitely less painful because they are sedated and they are inhibited in the brain. So if they are under influence, you immediately need to call somebody else as well, because you alone might not be able to handle that. Okay. And fourth thing, of course, is you tell more people. You tell their family, you inform their friends that this is happening. And never, what happens is sometimes we feel that, see, he has, in confidence, he has told me or she has told me. Maybe it is breaching the confidentiality, or what will he think about me if I talk about this to anybody else. But you have to be understanding this, that it's okay if you are the villain in a story. It's okay if in that moment they don't understand that, you are doing the right thing and they hate you for telling other people that, but that's okay. That is the responsible thing to do, to involve more people in the process, because you alone might not be equipped for that. Okay, this is the B part of it. Be there for them, distract them, involve more people. All right. Third part is checking. What do you check? Again, as I said, not everybody is going to come and tell you that they are attempting suicide or they are planning to do something. There are many warning signs and warning behaviors that you can look into, which can help you see that, all right, maybe this person is now planning on this. Okay. Now, these behaviors or these warning signs we divide into three categories. The first is verbal, second is their behavior, and third is mood symptoms. Okay. Verbal signs means they didn't say directly that they want to commit suicide, but they talk a lot about killing. Okay. They talk a lot about hopelessness, that how the world is a bad place, how there is no future, how everything is going bad these days. If they express any sort of, anxiety, that I'm not feeling well, I'm not able to cope up with something, suddenly if they are feeling a little isolated or little aloof and they're not talking that much, that could also be a sign. Another sign that could be is the feeling or expression that they feel that there is no reason to live for them, or if they feel that they have become a burden to other people. Okay, these are some of the things that they verbally express that could be a sign that they are thinking about or contemplating. Contemplating means they are plus minus about this idea, or this idea has started coming in their mind that might be suicide is an option, or maybe they need to think about it. Okay, these are the verbals. Second is a change in behavior. So what are the behavioral signs with which we can know that the person might be in the back of their head thinking about it? First being increased use of alcohol or drugs. Suddenly, the person will get involved into a lot of substance use. You will see that now they stay drunk every day, or now they are taking a lot of drugs, and mostly they are hungover only. Second thing is they start getting involved in reckless behavior or unsafe behaviors. Driving really rash, getting involved with multiple partners, having one night stands where they essentially don't care about their life, they don't value life. They get involved in such behaviors more and more, because essentially now they see no hope in life, no worthiness in the life. So they just do anything that, even if it harms them, they are not feeling responsible for it, or they don't want to do anything about it. Okay. Third thing that you see is that they are searching ways to end life. Maybe they are watching a lot of YouTube videos, or on Google, they are searching that how people commit suicide. What are the easier ways of doing it? What are the painless ways of doing it? All right. Next thing that could be there is social isolation or withdrawal, that they start staying aloof. They stop disconnecting with other people, don't respond to the phone calls, don't respond to the messages they got, and they try to stay alone most of the time. Next is, if you see that the person is either sleeping a lot, or suddenly he is not sleeping at all. These both could be a sign of some underlying mental health issue which is being expressed, and now it's going to, because see, if that is happening, mental health issue is happening, definitely the coping capacities are going to reduce eventually. So this could be one of the early warning signs. The next sign that we say is that suddenly the person is changed in their personality. Otherwise, they were always, maybe complaining and all, and suddenly they are so nice to everybody. Or it can be alternate as well, that they were nice to everyone and suddenly they are confronting a lot of people, telling everybody how they have wronged them, telling everybody how he or she has done wrong to me, being bad to me, how they were responsible for them getting hurt. A lot of confrontation going on, which they never did their life. Because essentially in the back of their head, they know that the life is going to end now. So it is important that they close the chapter or have some sort of a closure with the people in their life, so that when they go, there is nothing left to be said. There could be a lot of indications on the social media where the people share a lot of these posters where sadness is being expressed, or distressing material is being expressed, or sometimes now recently what we are seeing is that they leave the goodbye messages on social media. That is one of the common signs. So if you see somebody posting something unusual on social media, that could be one of the signs that they are planning this. Okay. So these were the behavioral signs: reckless behavior, substance use, increased addictions, increased alcohol, not caring about themselves, having confrontations or social withdrawal from other people, sleep disturbances, which could be sign of mental health issues, giving away personal possessions. So something they really love and do not want to get it as, suddenly they want to give it to their loved one, right? Because they wanted to stay as a remembrance, and they wanted to be a symbol of them in their life. So this could be one of the signs, and these are the behavioral signs of the warning signs of suicide attempt. Third category that we have is mood. The first was verbal signs, the second was behavioral signs, third one that we have is mood signs. Now, somebody, as mentioned earlier as well, sadness. That is the commonest thing that you can see in the people who commit suicide. Second is anxiety. A lot of fearfulness, especially in the COVID times with the lockdown when people have been isolated for such a long time. Anxiety is on a rise like anything. Okay. Earlier, people used to be anxious, but because they were always busy, they were not able to notice. Now, what has happened is they have so much time to think and contemplate. So, of course, the negative thoughts are increasing because the world definitely is chaotic. We see the news so much, everything is negative. We hardly see any good thing happening outside, although that is not the reality. That is just a perceived reality. If you look around, there are a lot of good things happening every day. But what our mind does to us is, because of all this social media nonsense and the news thing that keeps on coming, it reinforces the idea that the world is mostly negative and it is mostly bad things that are happening, which gives us a negative outlook and increases our anxiety instead. A lot of worry. And one thing that is common in these people is anhedonia. It is a psychological term which essentially means that people who used to enjoy something before, now suddenly they don't find any happiness or pleasure in the same thing. So somebody, who used to come and play with you every week, maybe you had cricket matches or whatever game marathons, now suddenly they feel that no, this doesn't give me happiness and I must leave. Otherwise, there could be a lot of increase in anger or irritability. These could be the mood signs. Alternatively, in some people could be that they are always irritable. Suddenly, from few days, they are acting very nice or behaving in a very nice way, right? Which essentially again means that they are on that verge. That all right, I'm already leaving in a few days. Let me just enjoy it. Okay. This is the warning signs, which is how to check the person who has not said that they are attempting suicide. Any of these verbal signs or behavioral signs or mood signs could be the indication that they are planning on it or they are attempting it, right? Now, the last part is of the ABCD is doing something, right? First step was being there. Second is, now what do you do? First thing that you have to do is not be judgmental. initially, whenever somebody expresses, we have all these judgments that you are like this, that is why this is happening to you, you deserve this because you are so mean, everything negative happens to you. In Indian context, and in our religion, so it's very common, purane janam ka you are facing, because you were so bad in your last life, in this life you are facing all these troubles. That is the worst thing anybody can tell anyone at any point of time in life, especially at a time when they are already struggling with their mortality, right? Then, first thing is this. Second thing is, now you have to encourage them to talk. Ask them to talk as much as they can. Ask them to ask as many questions as they have. And then the last thing that you have to do is make sure involve more people and encourage them to go to a professional. Okay? Because the way a professional can help, nobody can. There are so many factors involved in this. There are underlying depression, anxiety, mood disorders, psychotic, whole plethora, right? The doctor only can effectively recognize and make sure that it is not a physician. Preferably, it should be a mental health professional. A psychologist would be better than a physician or any other doctor because they are the experts of that field and they know what to do. Now, essentially, what the doctors will do is assess the situation. When we did the assessment, when we did the asking questions, I talked about two people, high risk and moderate risk, right? The high risk people, the ideal thing to do is that they need to be either admitted in a hospital or a rehabilitation setup, or if they can't afford it, or for whatever reason they are not agreeing to that, 24/7 monitoring is required. Somebody has to be there with them at all the time. And make sure, if you know about it, even when you'll take them to the professionals, you will see that the professional will always make a note of it and get the signature as well, that I have advised you to get admitted. It is you who decides not to do otherwise. Okay. Second thing, what we do is, if it is an emergency, we give some medications for them first to stabilize, right? It might look like that they are sleeping. Essentially, what these medications do is they relax you, they reduce that anxiety and sadness that you have, so that you start feeling a little better. Okay. One thing that I mentioned earlier is that there is a risk of at least 3 to 6 months of committing suicide again. So one thing that you also need to know here is something called as a paradoxical suicide. Somebody who has a mental health issue, if they have depression or anxiety, when they are on treatment, when they are under depression, they don't have the energy to do it. But what happens is, it is commonly seen that once they start getting better, they have the physical energy to attempt. Now, if they didn't get the proper treatment, they didn't work on those negative thoughts which were causing them to have all these beliefs that they need to attempt suicide, right? So if we didn't take care of that and only relied on medication to get better, what happens is, once they start feeling better, once they physically have the energy, but the beliefs are the same, that the world is a negative place, or it would be better if they left, that is when they commit suicide. That is why it is called paradoxical suicide. That instead of when they were sick, they were ill, they didn't attempt it. Once they got better, they do it because their belief, underlying one of the common beliefs that they have is, now that I have depression, or now that I have these illnesses, I'm never going to get better. This is how my life is always going to stay. So it's better that I. Okay. So with counseling, with psychotherapy, what we do is we work on these thoughts and we change these thoughts. It's called CBT, cognitive behavioral therapy, where we essentially try to change these beliefs so that people can think in a better way, think rationally, also find solutions for whatever stresses they have. If it is family issues, if it is relationship issues, there are always measures that can be taken to improve the conditions. So if we do all of that, essentially, of course, you don't need to know the medical part because there's not much that you can do there. But if you do all these steps, the ABCD, assessing, being there, checking the warning signs, and doing something, essentially contacting a professional, that is all that you need to do. And if we all know that this can be done, imagine how many deaths we can prevent. Okay. So with that, I have finished my presentation. If you guys have any questions, you can ask.
Guys, If you have any questions, please do type it in the chat box. Ma'am, I do have a question.
Yes, please go ahead.
Ma'am, as there are many reasons for the suicide attempt, so will there be a
Yes.
different behavior for different reasons of the suicide, ma'am?
See, the reasons will be different, but behaviors, like I mentioned, these are the common warning signs that we see. Okay, so when you see all these warning signs, when you try to check them, even if whatever the reason is, ultimately see it is a hopelessness or worthlessness or the helplessness. That is the reason that you commit suicide, because you feel there is nothing that you can do about it, right? So definitely the reasons can be many, but essentially it comes down to a few thoughts, which is essentially the feeling of being stuck, which a psychologist or a counselor or a psychotherapist essentially can work on, so that you try to see it in another perspective, you try to see it in another vision, and then they help them out.
Ma'am, there is a question. How do you,
Yes,
when
please ask.
someone is being suicidal, how do you come to know when someone is being suicidal?
So as I said, if they have directly said, you assess all these questions. Otherwise, these warning signs are the signs that if I'm not sure if they attended the whole lecture. So these are the warning signs which will show you that they might be suicidal, and that's when you do the intervention.
Ma'am, another question. How do you make
Yeah.
somebody open up to you about what they are going through?
Right. Okay. So it's a very good question. First thing, do not force them. Okay, like I said, be there, ask them. But if they are not opening up, all you need to do is tell them that you are there to listen whenever they want to open up. Sometimes the things are so personal, sometimes the things are so distressing that they don't even want to think about. But that doesn't mean that it has left their mind. It is essentially there inside, which is, comes back as overthinking or nightmares, or whenever you are, alone, it scares you, it comes back, keeps on coming back again. So that's okay if they don't want to open up to you. That is why you take them to a professional, because the professionals are already trained to do that. It's like years of practice that they have got to break these patterns only. That if they are not able to talk, how to make them talk. On your own part, essentially what you have to do is, first of all, give them the time. Don't force it that now itself you have to tell me. Don't emotionally, entangle them, blackmail them that if you don't tell me, I'm going to tell somebody. You absolutely must tell me. That's okay. Be there and also give them the space that, all right now you're not ready, but whenever you are, you should know that I'm there to listen. They will open up once they feel comfortable.
Yes, ma'am. Ma'am,
Yeah.
next question is, what if the person is being normal or does not give hint or speaks anything? How do we understand that?
With the warning signs. With the warning signs, you'll be able to assess. There is a very small fraction of people who commit suicide and don't give any sign. That's a very, very small number. In that case, anyways, we can't do anything. Right? You can only help somebody if either they directly tell them or if they show some signs. Otherwise, how do you know what is going on in your mind? Right?
Yes, ma'am, another
Yeah.
question. If they are in depression and taking medications, but fear is more in them,
Right.
what can we do that?
Yes. Therapy. So, the ideal treatment of mental health issue is not alone medications, it is always medication and psychotherapy, right? So, the medications are good to take care of the physical sadness that you have, the physical and the mental symptoms, but your beliefs and your thoughts need to be changed with therapy. Common term being counseling. In therapy, we do a lot of cognitive techniques to change these beliefs, change the thoughts, and then they start thinking otherwise. So fear essentially is coming from the feeling that the future is bad, right? That can be taken care of with counseling, not just alone with medication.
Yes, ma'am. Ma'am, another
Yeah.
question. Even after a lot of struggles trying to prevent them from that platform, they are still doing some same. So how to tackle such a person?
Again, see, you can do a very limited support. Okay. Again, if they are attempting again and again, if they are repeating the behavior, as I mentioned, they are high risk patients. They need to be admitted to a rehabilitation setup. That by not thinking about the family. Where the fact of the matter is, their belief is that nobody is thinking about them. That is the worst thing that you can do. Live for your family, live for your children. If even they know they have to do, but imagine the hopelessness that they have reached this level that even that is not an important thing, and they feel that dying is easy. Okay, so a professional help is the answer in that case. Never ever take it lightly. Put them in some rehab. Are not a bad thing. Some places are a little tricky. I agree with you. Some people in some rehabs, we do hear that there are some issues going on. Find a good rehabilitation, or otherwise just contact a psychiatrist. They'll be able to guide you what to do, and they have the resources, they have the necessary contacts, and then they are going to guide you how to go about it.
Thank you, ma'am, for that question. The next question is: Does depression recurs in phases?
Yes, definitely. Depression is a recurring and relapsing illness. So, if not treated properly, there is a definitely not a chance. Definitely, the chance of recurring are much, much more high. Even if the patient has taken proper treatment, the relapse rate, that essentially means that the chance of getting it again reduces significantly, but that does not mean that it will never happen. Yes, it is a recurring illness, so you have to take, just like you take care of physical illness, right? See, if there is infection going on, just because you had fever once doesn't mean you can't have viral again. Don't we take the necessary precaution again? So if you have a mental health issue going on, even if after treatment, the therapist is going to tell you that these are the things that you need to continue doing. Every day you have to do some mental health exercises. There are many, so that this doesn't happen again. Just like in physical illness, we tell that these are the measures that you have to take. There are many for the mental illness as well.
Okay, thank you, ma'am. One more question.
You're welcome.
Most of the time, wordlessness is the cause of anxiety and depression, and may
Yes.
often lead to be suicidal. How do we treat such
Yes.
person?
Yes. The worthlessness is as I said, one of the commonest beliefs that leads to suicidality, definitely. How you treat it is, where is this worthlessness coming from? So what we do in therapy is, sometimes, the person is good. He's a good average or above average student, but the parents have so many expectations that from the childhood they have told, if you don't become a doctor, you are nothing. If you don't become an engineer, you are nothing. If you don't take care of family, you haven't done your deal. This is where these worthlessness comes from. Or maybe they themselves have a lot of expectations from them, and then it doesn't get fulfilled. You want to achieve a certain dream, that is not happening. That is when the worthlessness comes. So why are they feeling worthless is the question, and what can you do about that why is what essentially takes care of it.
Ma'am, another question. Why depressed people are so much fear to do anything in their life?
Yes, that is what depression is. See, basically, it's a very big topic, but I'll give you an introduction very briefly. I'll just ask you a simple question. If your eyes are not working for whatever reason, no matter what pretty thing I keep in front of you, will you be able to see it?
No, ma'am.
Is it that beautiful thing's fault that you didn't see it? No, right? The
No, ma'am.
painting is pretty, or whatever is there in front of you is nice. It's not its fault. Your eyes are not working, so you can't see it. In depression, what happens is there are neurochemicals in our brain. Now, whatever is happening to you, you understand this is a happy thing or this is a sad thing, right? This is how we live our life. Something happens, we know, all right, something happy happened today, or something bad happened today. Now, to understand that also, we need a few neurochemicals in brain. One of them being serotonin. Okay, what happens in depression is this chemical is reduced. All right. So when this chemical is not there, even if happy things are happening in front of you, you can't notice it. Or you can't interpret it that this was something happy. You won't feel the happiness. So they are not fearful to do anything. That is what a symptom of it is. That they assume the worst case scenario. Even if they try, they assume that it's not going to go good. This is their belief. Nothing good can come to me. If I'll try to be a little happy, then worse things will happen to me. Every time I'm happy, something wrong goes around, right? These are the beliefs. So it's called depression. Once you start the medication, once you start the counseling, it goes away. That is how you take care of it. It is not their fault that they are like that. The brain has been wired that way. So you can't blame the person that they are doing it. You know what they tell them? You are negative. That is why this is happening. You need to think positive. It's just like telling the blind person that it's your fault you can't see. How ridiculous does that sound? Right? They can't.
Yes, ma'am.
That is why they are in depression. That is a symptom of depression. So how can, it's like somebody has a broken leg and you're fighting with them that why are you not running the race? Just stupid. Okay?
Yes, ma'am. Ma'am, another
Yeah.
question. How do we overcome somebody who has abandoned us, as in a relationship?
Right. Why do you want to overcome that? You just let it go. It is very difficult sometimes. See, understand this. People come and go in your life. The only one that is going to stay with you throughout your life is yourself. You are the only person. You are born alone, right? This is the, this is our Bollywood who has created the stupidest environment in the society, that we are not complete until unless the other person not there with us. Our life is complete when we have the other person. If that was the case, wouldn't God make us in a pair situation? Why would we be born alone? Right? So, if
Yes,
they
ma'am.
have abandoned you, my answer to that is thank them. They would have done it 5 years later and wasted 5 more years. Good that they did it now. Now get back on your feet. The only person responsible for your life and your happiness is you yourself. Everybody else is just like, they say cherry on top of the cake. Your own life should be so sweet and so nice that everybody else, when they come, that's great. If they leave, all right. You have to work on yourself, that why are you so dependent on the other people, and the more you are dependent, the more hurt you will be, because people
Yes,
are never going to be permanently in your life. Even if they marry you, even if they stay for long term, who knows, die first, then again you are alone, right? So,
yes,
and
ma'am.
then again, if you're not able to do it, that essentially means you might be again some depression going on or some anxiety going on that you're not able to let go. Take professional. You don't need to have a mental health issue to reach that level to go and ask help. Okay. It's okay. Even if, see, essentially counseling is for anyone who is not able to cope up with anything in their life, whether it's your career, whether it's your exams, whether it's your relationship, whether it's your family, any of your life. If you feel that you're not able to deal with it, take professional help. They know how to get you out of it.
Okay, thank you, ma'am. Ma'am, how do you treat
Yeah.
overthinking habit?
Yeah.
Question
So
from.
overthinking again. If it is just without mental health issues, what you essentially, some of the tricks, it's again is a very, big topic. So start with just writing everything down. You have to vent it out. Why overthinking happens is because our mind is functioned in a way that for everything it needs to reach a conclusion. So a thought comes, you didn't do anything about it, it will keep on repeat your head. Essentially, you need to solve it in one way or the other. Now, some things are there, for example, something has happened in the past, you can't let it go. You write it down, and then cognitive techniques that you can see it alternatively, that what other possibilities there. Other thing that you do is use some relaxation techniques, such as progressive muscle relaxation is there, box breathing is there, 1 to 2 breathing is there. You can just Google them. These breathing techniques will relax you. Otherwise, distract yourself, be productive. If you are involved in things that excite you, if you are involved in things that motivate you, you will not have time for these things. But essentially, how to stop overthinking is you do something about it or vent it out. Write it down, you talk to somebody about it. There are now apps about it as well, that you can just write down your thought and then you get over it. So essentially, that is how you solve the issue.
Thank you for that, ma'am. Ma'am, one more question. How are irritational fears or negative thoughts all this time caused? If they are talking about
I didn't
negative
get
thought,
you.
ma'am, how are irritational fears or negative thoughts are caused?
Are caused. Okay. So if you're talking about a healthy person who does not, in a mental health disorder, it is caused because of the chemical imbalances that you have. In a normal person, there are situations that trigger you. Okay. So there are some family issues going on. There's somebody in the family or friends who is irritating you constantly. If you're getting irritated constantly, again, essentially you need to do something about it, right? What happens, for example, in families, we have constant fights. You can learn some communication techniques, that how to communicate in a way that it does not lead to fight and it actually leads to some conclusion or some solution, right? Fear essentially is different from a negative thought. Fear is that you are predicting the future to be bad. You're assuming that future is going to be bad. So again, it's a very long process, but essentially what you can do is check the facts. How many times did you always wonder that it is a worst case scenario, and how many times did it actually happen? You're not a fortune teller. If we were, then the life would be, wonderful for all of us. We could all tell each other that it went wrong. No one knows the future, and 90% of the times, the worst case scenario never even materializes. It is our brain's way of protecting ourselves, that, it will prepare us for the worst so that we do something to take care of ourselves. But essentially, what happens with time is that fear becomes so much that we don't do anything about it. There's actually nothing that we can do about it, but that keeps on coming. So take help of a counselor to deal with that.
One more. How do you handle such cases with the people with age around 13 to 14, like around the youth age?
Same thing. If a person is brought to me, first thing that I do is that why this is happening. Whether there is a mental health issue going on or there is some family issue going on, and then the treatment or solution is based on that. In some people, recently only, not recently, morning only, I had a patient 10 years with a lot of anger issues and back answering and fights in the family. And when I talked to the parents behavior was such that the kid had no solution except to fight because just not listening to the child, right? So it is never the person who is responsible, although there are multiple factors involved in that. So in children, in kids, this is what we do. That where is this negativity coming from? Why is it coming? And we try to solve that issue.
Ma'am, one more question. It takes years together to cure
Yes.
depression. One of my friends take
Not true.
medication
This
for
is the
3 years.
biggest myth. Yeah. I know this is the biggest myth that people have, that it takes years. It takes 2 to 3 weeks for the medications to work. Now, again, the problem is that either they are not on the right medications or they are not taking the counseling therapy sessions to solve the issues. What will medications do? They are not going to take care of the stressor, na? They're not going to take care of the problems that are causing you to stay in depression. If you didn't solve that, this is very unfortunate. Morning I had a patient. He had been having depression from the 6 years, taking treatment for 3 years, right? And then never did any counseling session. Had one and then she felt no, nothing will happen. Another case, within 1 month she got better. Just 1 month, and she was suffering from 8 years. But she never knew that counseling has to be done. She was just on medication. Medication is going to do a part of it. It is going to make you feel a little better. It is going to keep you calm. But then those things which are bothering you are still, right. What did you do about it? This is the biggest myth, that it takes years to cure depression. It does not. When you start the medication effects comes around in 2 to 4 weeks. Everybody, responds differently. The right medication, you start seeing effect within the first week, but medication is not the answer. You need to work on the issues that have brought you to this stage, and you need to work on your own personal beliefs or thoughts which causing this negativity, so you are in that loop.
Thank you, ma'am. Ma'am, last question, ma'am. Ma'am, you said writing
Yes.
helps overthinking, but when I start writing, I felt more stress building up an anxiety.
Yes. So, this is a common quote, that you can't face your fears without facing them. For many people, this problem comes that when they start, they feel even worse. Two problems are there. One thing is, for some people, overthinking is so fast that the writing speed is not that much. For them, the answer is speak it in your phone, record it in your phone, make your own videos and watch it later. See if you relate to it. Sometimes what happens is, when we watch it later, we ourselves feel that, yeah, see, not that bad. In that phase, it's funny. Otherwise, what you do is, if that is not the issue, then essentially work on it. It is not just that you write it down and that work. What can you do about it? How can you solve it? Overthinking will only finish when you resolve the issue. If you're not able to do it on your own, go to a therapist. They know how to get it done. You will write down, they ask you to write it down, get the notebook to them, and they'll help you change these thoughts so that you are able to solve it. And yes, without facing your fears, you won't be able to solve it. That is the sad part of it. But yeah, there is no magic pill, na. We are not one of those babas that, all right, come to me, I'll put my hand and you are good to go. It won't be. It's a difficult process. Mental health are the worst. Okay, it is really, because I work in the field, I know how much people suffer. That I'm such outspoken that I have to talk about it, because so that more and more people know. If you are suffering even little, why do you want to reach depression? You can see that you are not getting help with overthinking. Get it sorted. Again, if it will keep on going on, it will become anxiety or it will become depression. Then it will become even worse. Why do you want to go through it? If you have little stomach pain, will you wait to become worse and then go to doctor? Don't you go on the first day, right? If it is unbearable for you, if you don't know what to do about it and you have taken all those children at home and not helping, you go to a doctor, right? Now that it's not helping, just go to a doctor, get it sorted. Okay?
Thank you, ma'am. Thank you so much for answering all the questions. I hope all of us have got
You're
to know,
welcome.
learn so much from you. Thank you, ma'am. Over to you, Jayashri.
You're welcome.
Good afternoon, everyone. Here I would like to start with a quote. Just when the caterpillar thought the world was over, it became a butterfly. The moment you are ready to quit, it usually the moment right before a miracle to happen. So don't give up. The true meaning of these amazing words are beautifully expressed by our honorable speaker, Dr. Ruhi Satija ma'am. On behalf of the Rotaract Club of Surana College and the entire Team Alpha, a big thank you, ma'am, for your efforts towards the Life is a Boon. It was great having you today. And also,
You're welcome.
yes, ma'am. And also, I thank all the collaborating clubs, Rotaract Club of Heritage Institute of Technology, Rotaract Club of Sunrise, and Rotaract Club of Coimbatore Unity for your support and presence. I thank all the audiences as well who have witnessed it as a memorable and successful event. Thank you so much, all. And this webinar is live streaming on YouTube. So thanks to all the participants over there too. Thank you all.
Thank you, ma'am. This therapeutical section will prove to be helpful to understand ourselves. We appreciate you, ma'am. Thank you so much, ma'am. Thank you for your time.
Thanks, and really congratulate to all of you for realizing that this is an important topic, and you should all know that the help is always around. Either find somebody you can talk to, or you have all these nowadays, so it's very convenient because even the consultations are online. Just reach out to somebody if you talk to. And one more quote that I'll quote here is that suicide does not end the possibility of that the world is going to be better. It just makes sure that you never get better, right? So understand that it is for you. I will never say that live for your family or live for relationships. Live for yourself. You have been given this life. Find a way to cope up with it. And one thing, remember, there is always a solution to every problem. There is no problem that does not come with a solution. Only thing is sometimes we can't see it because we are in a state of that negativity that we can't see it. So go ahead, find somebody who can help, and I'm sure you'll find someone. Okay?
Sure, ma'am. Thank you so much.
You're welcome. Take care, guys.
Thank